Welcome, guys, to another episode of To Mic produced by Mars Studios. Today, our guest is Mehrab Hussein. He is a registered nurse in New York. He's been practicing for 2 years. And yeah, please tell me a bit about yourself, Mehrab.
My name is Mehrab Hussein. As you said, I'm a registered nurse. I started working back in January 2023 as a emergency room registered nurse. So basically, I was in the emergency room, but I was also in the float pool. So how it works is that wherever they need us, we basically are trained to work in that department. So it can be med surg unit or telemetry or like cardiac, anything like that. And then I switched over to being a registered nurse in the pediatric clinic. So basically, I work with children in the primary care clinic.
That's good. Okay, so what what was the reason that you became a nurse? Like, what made you choose that field?
So originally, registered nurse wasn't the first, thought that came into my head. I was originally trying to become a pilot. So
Oh, he goes to aviation.
So funny part is that when I started, I was, looking into how to become a pilot. So I
Saw
started.
the price on that tag.
Yeah, it's pretty expensive. So I actually went to York College. My major was undecided, and within the first year, I actually switched to a different college based on recommendation, based on research, trying to get into nursing. I went to City Tech. I did not get in. And then during the heights of COVID, during Ramadan time, actually, I applied to St. Paul's in Queens. And Alhamdulillah, I got in. And
Alhamdulillah.
after what, 2 years, I'm a registered nurse.
So, was it like a hard process? Because I heard that becoming a nurse is like it's easy, but then they also give you a lot of stuff to take care of, like a lot of prerequisites. So how is that?
So definitely, just like any other field, any other medical field, actually, you cannot just go straight into nursing. Some people from high school, they apply to different colleges. Let's hypothetically say your college. There's the prerequisites, which they say you have to get B plus or higher. However, it's very competitive to get in. During my time, they only accepted about 30 students per semester. So now you have, let's say, 1,000 to 2,000 students applying. You cannot just have a B plus and then expect to get in. You also have to take a entrance exam. Um, and then based on your GPA, based on your score on the entrance exam, then you apply and you see whether or not, they accept you. For my case, at St. Paul's, there's actually two tests. So the first test is a 8 minutes test, which they still do have. They basically ask you the basic knowledge. So English, math, some science. At the time I took it, it was 50 questions in 8 minutes. So
50 questions in 8 minutes?
so
Is that multiple choice or something, or?
it's multiple choice, and some of them were short responses. So like math, you basically type in the answer.
But in
It's
8 minutes?
8 minutes. So it's pretty competitive. So you need to, during my time, I'm not sure how it is right now, you need to get 22 questions or higher in order to be exempt from taking the second test, which was, they call it HESI. That's a 3-hour test. That's more broader now. Like, it's in depth. There's a book that, people can study it. However, if you pass the first test, which you want to, because I can't sit down for 3 hours, it's just a lot of knowledge, I feel like. And then you could do two things. You can either take some of the prereqs, so like anatomy and physiology 1 and 2. There's two different parts. You can take regular English. For me, I took English 1 and 2. Over there, they require you. Given it's a private school, it's a little bit more money per credit than CUNY. So luckily, I took the classes in CUNY. Um, and then there's nursing classes afterwards, which you have to take, which are, for me, it was, I think, 900 and change per credit. So it's pretty expensive.
So $900 per credit.
Yeah, 900
Wait,
plus.
so you didn't go to any med school, none of that, right?
No, no.
It's just straight off after your bachelor's.
Yeah. So the way this specific private school works, along with other private school, is that they don't all follow the same thing. So St. Paul's in Rego Park, is they only offer associate's degree. So you can do medical assistant or you can do registered nurse. So a lot of one misconception they have is that after getting your associates, you cannot start nursing. Or a lot of people they don't look at look at it that way. They don't look in depth. So how it works, just to break it down a little bit, I graduated. For me, it was 18 months, 5 semesters. So we don't necessarily have that big of a gap like uni or other colleges. So our semester was from August until December, and then towards the end of December, you get like 5, 10 days off. You start the next semester. It's 15 weeks, and then you get 5, 10 days off. You start the next semester. So it's like a very accelerated
Smart,
pace.
yeah.
So once you get your associate's degree, you are qualified to take the NCLEX, which is basically the New York State licensing. Every state has every state is called NCLEX, RN. However, the questions are different, or like the difficulty of it is different based on state by state. New York and California are two states that has very difficult because there's laws, there's different rules and regulations.
So you had to go through all the CFRs and everything and learn all of them.
Yeah. So basically, for nurses, is based on your scope of practice. So you don't need to know like everything, like the laws that pharmacists has to go through, know the laws that doctors has to know. It might be similar, but it's not the same laws per se, just because your scope of practice, what you can do with your RN license is different, you know. So I took that exam during that my time. It was the old version of the NCLEX. Right now they changed it actually last year, I think April. So it's more critical thinking. There's short responses, there's multiple choice. For me, it was either all multiple choice or select all that applies. Um, 75 question is the minimum they can ask you during my time. Maximum, I believe it was 145 questions.
It's not bad.
Yeah, but the study process is different for everyone, you know. And then once you get your associates, you take the licensing. Inshallah, once you pass the licensing, you can start applying for jobs. You know, some hospital they're magnet recognized, so they're like at a higher tier. Magnet is usually a tier that everybody tries to go for. So New York Presbyterian, Northwell Health, they have magnet status. You know, that just says how safety, you know, the patients are, or like it talks more about like nursing specifically, you know, magnet status. And then a lot of hospitals, what they started doing, New York Presbyterian in the city, specifically, they do not take or hire any registered nurse without a bachelor's degree. So even if you do have, let's say, an associate's degree, you have your license, doesn't matter. Um, so near Presbyterian and Queens, Flushing, Main Street, they actually had a period where they're like, you know, we're trying to hire more nurses. If you're enrolled in a bachelor's program, you can apply for that job and then we'll interview you and, you know, based on that, whether you get it or not.
What's the bachelor's degree that you had to get for? Like, what is the...
It's also nursing.
So it's just another nursing bachelor's.
So it can be, depending on what college you go to. I went online and I completed my bachelor's within 6 months. So it's more for me specifically, since I took a lot of the prerequisites or the classes that you need to take to get your bachelor's. It wasn't a lot of classes for me to attain my bachelor's degree.
Bachelor's.
So how's your job at as a nurse? Is it fun?
So, as a new grad nurse, you know, it's definitely difficult, just like with any other jobs. Just, you know, you're handling a life, you know, you're looking after somebody's life. Depending on the field you go, you know, there with nursing, it's a great field. It's a field that I would recommend other people to go or look into, is because you have opportunities. Let's say you become a nurse, you have your bachelor's, you don't necessarily have to stay as a med-surg nurse, which is basically bedside nursing, you can switch over to pediatric, you could do adult, you can do, end of life care. It really depends. So, funny story. When I applied to Northwell, I went into their interview day. I did not know that you had to apply online. So I gave my resume to the associate director at that time, and he's like, "Oh, you're a new grad nurse. You will be good for float pool." Float pool, I had no clue what it was. I knew it was different departments, so, but I didn't know exactly what, I needed to do. So I interviewed with the float pool director of nursing and the manager. And, they're like, "You have associate's degree. We don't normally take it, but, depending on how you do on your interview, it has to be approved by the chief nursing officer, you know. And Alhamdulillah, that same night, I got an email from, or actually got a call from the associate director who took my resume at the time. He's like, "You did really well. I don't know what you said, but that director actually liked your interview, liked the answers you gave them. When would you like to schedule an appointment with the chief nursing officer?" So I chose a date, I did the interview, and I had to train. So with Northwell, it's a little bit different. You train off-site, meaning not at the hospital you work. They have like a institution
Like a
for,
hub kind of thing.
yeah, exactly. So you train there for, I'm not sure how long I did, I think a month. And then they transfer you over to the hospital where you're actually going to work. So the training was 13 weeks long, which is like what, 3 months and a week or so.
Yeah, that's
But that's just to make sure that you know what you're doing. You can provide effective, safe patient care. They're not just going to throw you into the floor. They're going to be like, "Oh, you're a registered nurse. You went to nursing school. You passed your licensing, and now you can practice." Because of how critical, this field is, the job that you're doing, you have to be trained before, you can work by yourself.
I think like that's pretty much true with every field though. Because like right now I don't work, but I'm planning on getting my aircraft mechanic license. It's pretty much the same process. Although you're getting your license after like 4 years of training, you have after like you go through a company or something, they do send you to your training. You need to go to their hub. So for example, Delta Airlines, they have their hub in Atlanta, Georgia.
Yeah.
So you had to work there for 6 months or something. Get all the necessary trainings, and then after that they will transfer you to JFK, LaGuardia, wherever you want to go.
Your station.
Yeah.
No, that's definitely a process that it's definitely a good process. Just
Yeah.
because if, let's say, they just hide you and throw you, you have your qualification, you can start working. That's very unsafe.
It is, yeah.
Just to dig deeper, as you being a nurse, isn't it like traumatizing watching these people die or like suffering? Because I would never, like, I'm just seeing someone die in front of me, like, yo, what do I do?
So it's definitely traumatizing. Everybody takes it differently. So I'll give you an example. When I first started, I was in the cardiac floor. A patient came in. It was for a different nurse. And the thing with nursing, especially in hospital and other field, is that we have different codes for emergencies. So rapid response is a code that we call when, patient's blood pressure is either very low or very high. These are just examples of why we would need to call. Let's say patient came in. They know where they were. They know the time. They know what's it called, the person that's in front of them. Let's say me as their nurse or their family member. 2 minutes later or 2 seconds later, they forget totally where they are and everything. That requires a rapid response because they can be having a stroke or something might be going on. And for stroke and other cases, you don't want to wait too long, because if a patient is having stroke, we need to give them something called TPA. That's the alteplase that breaks down the clot. And it's the clot buster, and they need to get different type of scans, so like a CT scan, to see where the clot is. If you don't do it in time, patient could die. So patient, I'm not sure of exactly like how that nurse got the patient. So from the gist of it, I hear code blue. Now, any hospital you go to, any nurse, any healthcare worker you ask, or even non-healthcare worker, they know what code blue
Yeah,
is.
they do
Like
it in the
first stop.
school too, you know.
So we here and with nurses and any other healthcare worker, you drop what you're doing and you go to that code blue, see what's going on. So we had to get a crash cart. It has the emergency medications, it has intubation kits. We get the defibrillator, that's just to give shocks if the heart stops. So we go in there, there's a team that comes when you so for Northwell specifically, we call a number and it goes they have a center where different people takes care of those codes. And they if you let's say if you call code blue, okay, the center takes that code blue, they relay the message to the team of code blue doctors, ICU nurses, respiratory therapists, and then they come to the floor. You give them locations and everything. So I went in there, I see the nurse started the CPR process. They're what's it called, pumping the chest
Damn.
to get it to start again. Now, it's a very stressful environment at that time. Unfortunately, patient I think was in their 90s, and mind you, I just started off as a nurse. I've never seen like a person die in front of me or like my patient, except like what's it called, family members or at the mosque when there's janaza. So although it wasn't my patient, it hits you different.
Yeah, honestly.
Like what do you do? Patient just died.
He just
They
died.
they defibrillated, they gave um chest compression. Nothing worked. Unfortunately their time came and they passed away. Now, one thing I did realize is that the team that came, which was like resident doctors or doctors, um, I saw one person actually smiling. And it wasn't necessarily to disrespect what just happened, but it's just that as I went through my career, although it's just my second year of nursing, that's just how they cope. One thing they don't teach you in nursing school or med school or pharmacy school or any, healthcare field is that they don't teach you how to cope with death. How do you cope with it? You know? So the team of doctors, this patient just died. Now they have to go to another code blue. They just have to continue on with their day. So it hits everybody differently. For me, I was just standing there. I was like, I don't even know what to do. Like, what do you do? A patient just died. You know, so far while I was at that hospital, I saw about 3 people die right in front of me. Chest compression, nothing helped. But as healthcare workers, it's our job to try the best we can to help that person. Doesn't matter your race, ethnicity, gender, doesn't matter where you come from. When you're at the hospital, you are our patient, you know?
What's the most craziest story you have? Is that it, or
No,
like the most
there's definitely other crazy story.
like named like the most craziest, like someone got shot or something, or
No. So luckily, the place I worked was a trauma center, so we had helipad. So
oh,
there's different level trauma centers. So we were level 1 trauma center. So
As in
we
like
had
that's the highest level or
yeah,
like
that's the most critical. So like we have the equipment to treat stroke patient, any types of surgeries and all those. With a helipad, they use the helicopter in cases of emergency. Let's say,
this is here.
yeah,
There's helipad there?
yeah, in certain
where
hospitals.
you been living, bro? You live in New York City. That's
Queens
helipads,
Hospital,
like
No,
no,
not Queens.
this is not. Oh my god.
It's in
I never seen it. Oh, man, okay,
Yeah.
probably.
So like Queens Hospital, if you take, for example, it's a community hospital. So they're not trauma center. They don't have enough equipment or enough resources to be a trauma center. They still see, gunshot wounds and whatnot, but a lot of them gets rerouted to, let's say, Long Island Jewish Hospital or let's say Manhasset or Long Island Manhasset North Shore University Hospital, Jamaica Hospital, or LIJ. Those are trauma centers. You know, Craziest story was it was fairly elderly patient. She was I believe in her 90s also. We got a lot of elderly patients.
I mean,
Don't get me wrong. But still gotta take care of them. At the end of the day, that's what we signed up for. Help the patient to the best of our abilities. Um, Patients started deteriorating, meaning their blood pressure is very low. It's like they're not mentally and physically there. Some patients you can see. So that day I had 5 patients in the emergency room, and I was helping another patient at that time. So we have PCAs, those are nursing assistants. So they also helps us, on our day-to-day activity. So blood pressure, doctor wrote the order, check every 4 hours, and then we have to document. Blood pressure is very low. The nursing assistant checked it on the right arm, it was low. Checked it on the left arm, it was low. So what's going on? You have to let the nurse know because it's an emergency case. Patient was not answering questions. It was very elderly patient. So I called a rapid response because as a nurse, anybody could call a rapid response if a patient's deteriorating. So I called a rapid response. The team of doctors came. I explained. We used something called SBAR. So situation, what's going on, background. Why did they come to the hospital? A is assessment. What did you do when you saw like the low blood pressure? Or like when patients started deteriorating, what did you do? Did you notify doctor? Did you call rapid response? I did. And recommend, R is for recommendation. What do you recommend we do? Obviously, when there's what's it called, emergency cases like that, we call the team, or the doctor. If they're there, we call them, or if they're not there, we still call them. Patient had to be intubated. I remember like it was yesterday. Patient's daughter was at the bedside. Patient daughter, they're crying because what do you do in that situation? It's your parent or it's your loved one, you know. So daughter was asking me, what's it called? Should I call my dad? Should I call the family members? We're like, yes, you should. Even though it's very congested, or it's always congested in the emergency room, in those scenarios, if you think patient might be deteriorating or patient might end up dying, it's fine. You could call the family, You make the judgment call, or any other members of the healthcare field can make that judgment call. Family came, they're crying. So the managers at that time, they were, comforting the family. I mean, how do you comfort somebody saying whose family member or loved one is literally dying in front of their eyes? Patient had to be intubated. They were taken to the ICU, which is the intensive care unit. They were put in what's it called, a medical coma, until we can, fix what's going on. Why is their blood pressure low? Why are they deteriorating? Again, it's elderly patients, so a lot of
And
things.
the doctors weren't able to figure it out, or
At that time, it's emergencies. You can't just look at labs and just be like, oh, okay, this is what's going on. That could be a clue, but you run different tests in order to confirm, okay, they're actually having a stroke, or they actually have a blood clot, let's say, for example, So they were taken to the ICU, and as I'm taking them, like, I don't know if you ever seen somebody dying, you know, you could see like their eyes was wide open and they're just looking up. It's like their soul or something is just, they're just looking up. So we helped them to be taken to the ICU, and then I'm not sure what happened after that because, again, that day I had 5 patients. That patient just left, and the emergency room, although I'm saying emergency room, we have something called overflow. That's where I used to work. That's once you're admitted, you get placed in that area until we can find you a bed upstairs, on the actual floors. So beds aren't the comfortable, and the care is the same. I'll be honest with you, care is the same in the emergency room versus on the floor. The only difference is how packed it is, what types of beds you get, but care is the same. So patient was taken up, and the emergency room gave me another patient. Hey, you're getting another patient because it looks like one of your patient left. So
God, that's
I don't have like that moment or second to just recollect what's going on. I gotta get ready for
the
the
next.
next patient.
But okay, another question. Do you guys have like a tier list in like who do you serve first? I mean, that's pretty obvious because I remember when I was little, right? I was at Tilly,
Yeah.
and then I fractured my arm, right? I was like 10 years old. And man, when I went to the emergency room, they took like hours. I was dying right there. And then, so you guys obviously have a tier list, right?
We definitely do have a tier list because that's how we decide which patient is in critical condition.
Mhm.
Let me give you an
How
example.
do you guys determine that though?
It's based on what you come in with. So let's say a patient with a gunshot wound came in.
They are prioritized.
You came in, I'll use you as an example. You came in with a fractured hand. They have a gunshot wound to the chest. Who do you treat first?
Gunshot.
Obviously the gunshot, because you could be bleeding internally.
Mhm.
Obviously, we still get to you, you know, maybe not as quickly as the gunshot victim, but we still get to you. And the tier list is just like that, based on the symptom, based on what you're coming in here with. So let's say you have the stomach flu and then you fractured your arm. Who do we take care of first? You, because your case is more critical.
Makes
At that point, if you're bleeding, you might bleed out. We don't want that to happen. You know, we still get to that other person, but we prioritize. We call it equity level. It's how serious your condition is.
So how many doctors are there on site to like treat these people like ASAP? You know, they can't be like just one doctor.
No, no, no.
There has to be like obviously more than, yeah.
There's different amounts of doctors. So in the emergency room, you'll see a lot of physician assistant, nurse practitioner, and resident doctor. Resident doctor, they're the doctor that finished med school. Now they're training. You know, depending on what field you choose. If you do emergency room or you do family medicine, you do different years of training as a resident doctor. So it really depends on the hospital, honestly. So a resident doctor can have, let's say, 10 patients, hypothetically. It's never 10, it's more than that. They're looking after all those patients' care. And then whatever decision they make, whatever their assessment that they did, you know, they go to the attending doctor. That's the one that overlooks all the care. So there's different amounts of doctor. I can't just say, you know, there's one, two, or whatnot. It really depends on the hospital. And they're the one that signs off on it. Hey, okay, so let's say a patient is having a stroke. CT, they did a CT scan and it came back, you know, yeah, patient's having a stroke. What do? You give Altepace, you know. Resident doctor takes it to the attending doctor. Okay, you know, you're right. Let's continue with that treatment. And then they monitor, basically.
So basically you do what the doctor says, right? Like,
Yeah,
so
so
you get the
we
order.
carry out the assessment that, or the orders that the doctors, physician assistant, nurse practitioners, they write. So let's say in the emergency room, again, every hospital is different how many patients you have. From what I remember, North Shore University Hospital, their patient to nurse ratio, meaning every one nurse, for one nurse, how many patients can they have? So it was, I think, 8 or 9. I'm not, don't quote me on this. because
Isn't
they
that
always
like a
change
lot
it.
though?
Huh? It is a lot. But there's one other specific hospital I'm not gonna name. They can go up to 15 patients for one nurse in the emergency
15?
room. Yeah,
Nah, that's bad.
that they have to take care of them. So we do blood draws, we give them medication, we send them out to do the scans, we carry out the orders that are written. Let's say this patient came in, their blood pressure is very low or very high. So doctor says, okay, or one of the providers says, okay, let's check their blood pressure every 4 hours. And then we'll go based on that. We carried that out. And then we have, remember I said there's PCAs in the beginning? PCAs are nursing assistant. They also help us out.
Yeah.
Let's say simple orders, let's say blood pressure. We will have the PCA. Hey, can you do blood pressure on patient X, Y, and Z and room 2 every 4 hours? So that's what they do. And then we look in the computer. Okay, this is their blood pressure. What do I do? You know, everybody in the hospital are working together simultaneously. You know, one misconception or not misconception. One thing a lot of people say, oh, you're a nurse, so you must be wiping people's, bottom. Yes, we do that. But do we feel shame? No, absolutely not. Because let's say your loved one went to the hospital. They cannot get out of the bed, right? And they poop themselves on the bed. Who's going to clean them? Are you, as a patient's family, coming in? Some patient's family helps. Other patients, you cannot leave the patient there in the bed, with their feces on the bed because they can get infections or like other stuff. So yes, we do clean butts, but am I, ashamed of it? No. Again, as I said, you have ample amount of opportunities with nursing. So I was on the float pool for What?
What is the flow pool you keep on mentioning, but you never
So flow
expect
pool,
it?
it's you are trained in different departments. So I was trained in neuro, which is the brain, cardiac, which we look at a lot of. We take care of patients with cardiac issues. So almost all the patients on the cardiac floor are on telemonitor, meaning like we see the EKG, we see their heart rhythm, how are they doing, and we have a computer that's all those patients are connected to that computer, and we look at it. Is the patient no good thing is normal sinus rhythm. That means the heart is doing the normal beats or whatnot. We're trained in pre-surgery, so before a patient goes to surgery, they're on our floor. We do the pre-checklist. Okay, let's say a patient has to get a appendicitis surgery. It's not, the patient's condition is not too critical, so their surgery is at 2 o'clock. Until 2 o'clock, we give them medications, we give them antibiotics, we give them whatever is needed or whatever the order is. So we're trained in different departments, and how it works in the hospital I've worked at is that we find out about half an hour to an hour before our shift starts which department needs us. So let's say, for example, cardiac floor today, one of their nurses called out. So somebody has to go, help them out. So our managers are like, okay, we're gonna assign you to go help that, floor out. So our shifts at that time, my shift was 7 a.m. until 7:30 p.m. But obviously we don't, just because our shift is at 7, I don't go in at 7.
You go at like 6:50, 6:40.
Yeah, or even earlier, 6:30, just because I have to look over the patients I have for the day, which nurse I'm taking over from, the care for the patients, and I have to look at their chart. Why are they here? What has been done because of their condition? Let's say, example, you came in with a stomach flu, it's very critical. What are we doing for them? So I have to look at all those, and it's called chart check. So basically, we're looking over their chart, and then we get a report from the night nurse, or if you're a night nurse, you get a report from the day nurse, and then you take over care. Now, just because our shift ends at 7:30, again, you don't just leave at 7:30. You have to give report to the night nurse that's coming in. You know, so that's what we do in the flow pool. And then now I just recently started as a pediatric registered nurse.
So there's a lot of data you're dealing with, right?
Oh yeah, of course.
Aren't you fearing like you make a mistake, or like have you ever made a mistake? Or
So I'm not gonna. Okay, I'm not gonna say whether or not I made him. Okay, I am gonna say I made one mistake. It was not it was not life-threatening mistakes. But there's ways to avoid those mistakes. It was once we had our talk, because any mistake you make, you have to let the doctors know. You have to let your manager know. There's like a whole step-by-step process of.
Yeah, you in the airlines they have the same thing. It's called the human factors, right? So basically, the human factors is let's say when you actually mess up like pretty bad, where you could like kill like the whole plane, right?
Like, how do you fix that? How do you avoid that from happening in the future?
So the yeah, basically, right. The thing that you do is you mess up pretty bad. You messed up the engine, right? Let's say you messed up the engine, and obviously you're the main part. And all you had to do is you go on there's this thing called ASAP or something, where you go into the FAA website, you register, say that this is what I did, this is what I need, I think this is what caused it, and then you have to write a whole essay about how and why you got there.
it's like a report.
Basically a report, but that report has to be like, I messed up, I did this because of this, and then I think that in the future I need to do this in order to fix that.
So self-evaluation.
Self-evaluation, but I think like nursing, right? Nursing, aviation, fields, like all those fields that deal with people's life do have the same procedure. Like everything that he's saying right now, I've been hearing everything that he said, right? Like it's like whether it be like going through dealing with data, like actually telling the other person what you did, like shifts, changing shifts and everything is the same thing. Except the only thing that you're doing is that person is dealing with the human aspect of actually working on the human body, and then like in my case, I will be working on the mechanical part of it, but mechanical part of the stuff. But that's the same thing. Like they go to the degree that if you they don't let two people they don't let the same person work on two engines in the same plane.
So, yeah, so there's no
Yeah, that's the safety
misconception.
measure that they
Yeah.
put in place.
So if you work on one engine, I cannot work on you cannot work on the other engine. I had to work on it.
Yeah.
And if let's say for example, we also have like there's like mad restrictions for that. Like there's a lot of restrictions at the same place.
So if you screw up, it's all on you.
If you screw up, it's all on you. But if you try to hide it, expect the federal FBI to be on your front door.
Damn.
Like if you don't hide it and you actually mention that you did mess up, then they actually like come up to you. They still come up to you regardless. The FBI and FAA is going out, NTSB, FAA, and the company is going to be on your door, knocking on your door regardless. So let's get that straight. And they're gonna come up to you. They're gonna ask you like if what did you do and everything, right? The human factors, you had to write a human factors report and everything. But if you try to hide that,
Yeah, that's like a big no.
yeah, that's the same thing that's happening
It's
with
like a
the.
crime, basically. The cops will come knocking on your door.
Yeah, it's a crime, but the crime that you do might be because of stupidity that you did. Like this, you just like forgot, you know. But if you
forgot to put a screw.
Yeah, but if you forgot, if you like hide it, you're going to be put in a prison where like the worst of the worst are put in, like federal level prison. You're not going to know Rikers Island.
Damn.
So,
Yeah.
I mean, yeah, for sure. And I feel like one thing, not just healthcare workers, like a different field, they should keep in mind is that if you make a mistake, yeah, just own up to it.
Yeah,
It's easier said than done for sure, depending on the mistake you made. Some people they're like, oh, okay, it's not too big of a mistake, but it is to a certain extent. There are rules and regulations that you have to follow to, keep everything smooth, safe for everybody.
Do they have like a set hours that you could work at? Because I know for the airlines, as far as I heard, that you could work up to 4 days, and the fifth day there are certain conditions to working on it. Right? Obviously, you get money to like overtime, but it's recommended that you only work 4 days and then you take off because of the stress level that you go through for the 4 days. So 3 days
Like
off,
straight up 4 days.
straight up 4 days, or you could spread out the 4 days.
Is that true?
So,
But I don't know about the nursing side of it though.
no, for sure. So again, depends on what type of nursing you go into. Do you want to do bedside? Do you want to do clinics? So some clinics you work 4 days on, 3 days off, or you do 5 days like a 9 to 5 job. Obviously, they have different shifts, and you're off for 2 days. The shift right now that I do is Monday through Friday, 8 to 4:30. Some days I might have to stay back because doctor is not done with the patient. We don't just leave. You can because your shift is up to them. But again, or it basically goes to show if you're a team player, we're there for our patients, regardless of again your race, gender, ethnicity, doesn't matter. Previously, in the other hospital I used to work at, it was bedside nursing. It was 3 days on, 4 days off. So those 3 days, it was like 12-hour shift. But if you count the time that we come in, which is 6:30 or 6, and stay back or whatnot, it can be up to 14 hours, and you get mentally and physically tired doing that. Do I miss it? 100%. But at times I'm like, I have a steady schedule. I'm working Monday to Friday. I know I'm off on the weekends and holidays. Why not? Some people they look at the money aspect. Money is there. Again, at the end of the day, what I've realized and still am realizing is that money is not always, the thing that should drive you to be like, oh, okay, I'll take this position because they pay a lot of money.
What are you talking about?
Stress level over there, I saw deaths. Still see death over here, even though it's a clinic. I still see emergencies that I have to call for the pediatric patients. Pediatric, the range is from birth until 21 years of age.
So
Um,
pediatrics is 21. I thought it was like 18 and
that's the group that we take care of. So some patients after they turn 18, well, okay, I'll go to adult primary care, but you can stay up to 21 years
Yeah,
old.
I heard you could.
It's a funny story. The other week we had a patient who just turned 21 and they wanted to still stay with the pediatrician doctor because the doctor is great. Honestly, the doctors I work with, if I were to recommend, if I were to have my own kids, not married, don't have kids, but I would recommend them just because I see the way they care for their patients, you know. So the doctor's like, you have to choose a primary care in a few months or so because you're 21. You can't just stay, over here. I would love to keep you, but unfortunately, that's just a rule, you know. So, yeah, it really depends. If you do bedside nursing, if you do clinics, um, it's a very open field. Yeah.
so how does like logging in all the data and like what you did works?
Oh yeah, and
Mhm.
about the mistake, you didn't finish the.
So the way the mistake happened, I'm not gonna go fully into it. So after the mistake was done, I spoke with the doctor, and the doctor's like, okay, you were supposed to give this medication at like let's say hypothetically 5 o'clock. You gave it at 1 o'clock, right?
Oh, okay.
It was not like a life or death situation. How is the patient taking it? Like, what is their reaction to you giving the medication early? It's like a whole step by step process. First I let my manager know. They're like, okay, let the doctor know also. I was new. I should have just went to the doctor, but again, it was like within minutes. I'm like, I have to. I don't want to make a mistake. At the same time, I'm putting my patient's life in danger, or in my mind. But it wasn't elected right. They're like, okay, so what exactly happened? The night nurse told me to give the medication at 5 p.m. right next door in the same room. It is covered by like a curtain,
Yeah, like right.
so you get privacy to each patient. That patient was supposed to get it at 10 a.m., whereas this patient was supposed to get it at 5 p.m. Two different medication. I gave it to the right patient, but I didn't realize the time difference.
The time.
You know,
Oh,
and one good thing that not all hospitals have it, some hospitals they do have it, is if you make a mistake, they're not gonna fire you over it. You know, that's how they get nurses or other healthcare workers to come up. That way, we prevent mistakes like these from happening from other providers doing these mistakes. I went to the doctor. Doctor's like, that's fine. As long as he told me, just document it, right? At that hospital, we used a software called Sunrise. Um, I like Epic better. Epic, they have like everything, in the system. Whereas Sunrise, you have to type it in and whatnot, you know. So I told the doctor, I told the manager, and then you have a sit down with either the manager, director, and it could be a scary process because
And then you exactly go through the same process.
you're like, am I gonna get fired? Am I gonna lose my license? Am I gonna be brought up in front of the what's it called, licensing board? So we sat down and what's it called? They're like, so what exactly happened? So I told them that both patients, it was like the time difference. It was in the same rooms, um, but when I scanned the medication, it was the right medication. Just to be clear, it let me go through. It let me continue on to the next step. Right as I started the medication, I realized, and I let the doctor know, so we stopped her right away. So they didn't get too much of the medication, and it was just a thing of regular medication. I'm not sure the exact name. So they're like, okay, so we had to get pharmacy involved and because how do we prevent the system from allowing us to just continue, even though it was the wrong time? We call it open parameter, meaning you can give it a different timing. There's not a specific time designated for that medication. So again, I've done the mistake. I've learned from it. Told the patient, told the family, because you made the mistake. You have to let the patient know. So again, we went about it. We fixed the mistake, and then continued on. Yeah.
so is there like a, so you could eventually with more experience go higher in the leaderboards, right? Or like you could become like chief, or like you know what I mean, right?
Bro, it's always like down that gimme thought.
For sure, and that's why I say, if I were to recommend nursing to other people who's looking into nursing, um, So let me just break it down just to make it short, right? You become a nurse, you get your bachelor's or associates, you get your license to practice, and then you start working. The highest field in nursing is CRNA, which is Certified Registered Nurse Anesthesiologist, and Doctor of Nurse Practitioner. That's the highest tier. With those, it's up to you. What do you want to do? Do you want to go for chief nursing officer? Do you want to become a director of nursing? You know, and then there's nurse practitioner, which is the tier above registered nurse. You know, um, and that you go back to school. Nurse practitioner, that's a 2 years, depending on college. If you're doing part time or full time college, it can be 3 years. Really depends on you, right? So once you become nurse practitioner, you can practice. Some state nurse practitioner can work without the supervision of a doctor. Other states you have to work under the supervision of a doctor. And then after that, if you're like, oh, okay, so I want to further my career, I want to further my knowledge, I want to know more about nursing, you can become a doctor of nurse practitioner, which is DNP. You have a doctor's degree at that point. Again, you choose what field do I want
So
to.
have you ever wanted to be a doctor? Or like, let me be a doctor now?
So, when you're in elementary school, everybody wants to be a doctor.
Oh, yeah.
I'm just generalizing. A lot of people wants to be a doctor. Again, in my 5th grade yearbook, if I go back, what do you want to be when you grow up? I want to be a doctor. And then I went to high school. Okay, I want to be a pilot. And then after some thinking, okay, I became a nurse. And then now I'm doing my master's in public health. You can get your master's in nursing. The reason I decided public health was because I'm like, I don't want to just solely focus on nursing. I want to know, like, have a broader knowledge on the entire field of, healthcare. So with a master's in public health, you can become different. You can do different jobs, such as, let's see, I'm just having a loss of thought right now. You can become like associate director. You can become manager. You can become director of nursing. Again, every hospital is different.
If you're enjoying the podcast, make sure to like and subscribe. Over 90% of you guys have not subscribed yet, so please subscribe. Boom.
So like, what are some thoughts came into your mind when you were choosing the field of nursing? Like, was there something that shaped you to choose that field, or like?
So, just like a little background about me. Again, I wasn't the brightest in elementary, middle, or even high school. Um, However, a couple of my family members, they're in the medical field, pharmacists. So it's something that you think of, okay, is that something I want to do? So I became a pharmacy technician. Again, for that, if you work in retail, you don't necessarily need to have a license, but if you work in hospital, you have to. I've realized at a point in my life that that's not something I wanted to do. Although it was very interesting, you're learning about medication and everything. I was like, no, I'm not cut out for that. So going into nursing, I was like, I'm not the smartest. I definitely was not the smartest in nursing school. But does that mean that I don't know what I'm talking about? I don't know what I'm learning? I can't provide safe patient care? That's not true. Just like med school, if you're thinking about med school, do your research. Don't just go into it just because somebody told you, or some uncle or auntie's like, oh, okay, you should think about med school, or you should think about physician assistant or whatnot. Do your own research. Listen to people that you can trust. Read, what's it called? Read articles or read news that you can actually trust, because anybody could say anything about a different field. For me, nursing, I had to do a little bit of research. To get into nursing, it wasn't the easiest. It was pretty difficult. I well, I didn't pass the entrance exam, I think, twice, and then during the third time, even though I studied like my butt off, if you were to ask a lot of my friends or family member, you would have seen, they would tell you, how much I had to study for the entrance exam. It breaks you, because after once you're like, okay, do I want to try again? Again, I did it. Again, failed. Just a couple of points. The prereqs, I was good. Um, I got good grades in it. However, still nothing. So, um, in 2020, I think in summer, I was like, okay, I don't want to go to nursing. I want to become a radiology technician. I finished the prereqs. All I had to do is just apply at that point, right? And then the opportunity came up, nursing school. I saw an ad for St. Paul's. So I was like, oh, are you interested in nursing? Do you want to, apply for it? I got to their information session. I'm like, okay, let me apply. You know, took the test. Still wasn't sure if I got in or not. So I found out in July to early August that I got in, and I was supposed to apply around the same time for the radiology technician, what's it called, program at City Tech, and I just completely left that. I was like, I've been trying to become a nurse for so long. I've been trying my hardest to get into nursing. So since I got the opportunity, why not? And then, here I am 2 years later, 3 years later, I'm a nurse. And, when you're in school, you're like, that's it. I don't want to go back to school anymore. But once you finish, you're like, okay, what now? Do I want to go back? Do I want to further my education? And there's not really a right or wrong answer. If you don't want to, just stay as a nurse, stay as a physician assistant, stay as a nurse practitioner, stay as what, you're doing or what you graduated with. Or you can go back to school, further your education. Where the field of nursing is growing, we are losing a lot of nurses. It's either because of the patient to nurse ratio. There's too many patients for one nurse, or the nurses that's in the nursing field, they're aging. They're getting near their retirement age. In the next, 5 to 10 years, we're gonna lose a lot of nurses. We need a lot of doctors because, as you know, getting into med school is a hideous process. It's very difficult to get into. You have to take the prereqs, you have to take the MCAT, and then you have to apply for med school, which is not always guaranteed you're going to get an interview. Let's say you get an interview. It's not guaranteed that you're going to get in. So you got to put in work, in life. Whatever you're going to do, you have to put in work. Now, if I look back 10 years from now, if you were to ask anybody and be like, oh, what do you think he is? If, let's say, I didn't have contact with those people I knew 10 years ago, if you were to ask them, nurse would not be something that comes into their mind. That's the type of kid.
So like what shaped you that career choice, like, right? Like that choosing process, like I think a lot of like kids who are in high school and everything, they do go through that process of like what major should I apply to, or like what should I do? And there's always someone knocking on their door like saying, oh, you need to choose right now. So like tell me a bit about that process, that, and like what are some stuff that happened or things that shaped you to be that.
Also, to add on, family is also a key because they peer pressure you
Yeah, that's
or
what
something. So how's that like shaped your
So
decision making?
I think in the Asian culture or the South Asian culture or Asian culture in general, right? They're like, oh, you can choose the top three: doctor, lawyer, engineer. You know, anything else doesn't matter. For me, I didn't really get a push for the medical field. As I said, I wasn't the brightest student, in elementary, middle, and high school. You know, um, but having those role models, or that I thought of them as my role model, let me rephrase, that kind of shaped the person I am. And also shadowing. You have to shadow, whether it's in the hospital, whether it's private practice. Anytime I go to the doctor's office, or as a kid, something doesn't look bad. I think I could do it. I don't know if I'm smart enough, but you have to take the leap of faith. You cannot just be like, oh, I'm not smart enough. Let me not go for it. You know, you have to take that leap of faith, and also taking that leap of faith, it really comes down to research. At the end of the day, whatever you want to do, you can't just be like, okay, I went onto the airplane. I want to be a pilot. Sure, you can become a pilot, but did you do your research? What does it take to become a pilot? Having that background knowledge is very simple. Technology is improving. We have everything almost at the tip of our finger. Just like you said, aviation. What made you choose aviation over, let's say, the top three things our parents tells us about: doctor, lawyer, engineer? How did you go about choosing that field? Yeah.
Yeah, that's not a choice. It was so my I go to aviation high school, right? So like it's just a trade
The
school.
name.
It's like it's just basically like Edison. You know what I mean?
Yeah.
So I just went in. Oh, there's like this thing. You know, it's like, oh, there's this program.
Mhm.
By the end of like the 4 years you graduate, you get that license.
Yeah.
So basically, I just went to high school, and then there was this extra program like college course. I'm like, why not? You know?
And I think that really shapes one thing I would definitely like to see in a lot of high schools, especially, right? Is teaching the kids about finance, teaching them about future careers. When I went to Thomas Edison, I was in a automotive shop. That was one extra curriculum that we had to take. You have to choose a specific shop class.
Yeah, he you know about it.
About
Edison's trade city school.
Yeah. So,
Like,
like, you can do medical assistant. It's not that you become a medical assistant. They give you like you shadow,
you shadow
you
basically.
learn. So when I was in the automotive shop, I've learned about cars. Do I know everything I learned? Probably not. But good thing about this high school that I attended, I had that, little bit of knowledge that they implemented in you. Um, and then you go based on that. And any field, don't always go based on the what's it called thing. Like, remember I was saying how nurses have this thing image where, oh, you clean butts for a living, you know? Yes, again, don't go based on just cleaning butts. We do much more than cleaning butts. Let's say you're going back, let's say your family member was having a heart attack or their heart stopped, right? Who is at the bedside most of the time? Is it the doctors? Is it the nurse practitioners or any of the providers, or is it nurses? It's nurses and PAs, PCAs. You know, we're at the bedside almost 90 to more than 90% of the time, right? Let's say if you say, oh, you just clean butts, right? What? So if they're having a heart attack, who's calling those emergency calls?
You're
We are. But people don't look at that. They just take the first thing that comes. Oh, yeah, you're a butt cleaner. But again, that's why I said when you're choosing any field, whether it's nursing, whether it's aviation, whatever it is, right? Don't just go based on the stereotype or the misconception of, oh, pilots do this, or like one misconception I've heard, and I still hear, right? It's
about
not
what?
fully wrong, it's not fully right. It's that, oh, nursing is not a hard job. The second misconception, because the first one is a butt cleaner. We do clean butts, it's pretty smelly, but uh, you get used to it as you do it. But now I'm a pediatric nurse, and I don't have to do that. If I were to go back, I definitely will go back, but I would choose a specific department because float pool is very stressful. It's not for everyone, but you do gain a lot of knowledge about the different department, right?
So like, what are some challenges you faced when you were growing up?
Um, so just like a lot of immigrant families, I came at the age of 8 to the US, so not knowing English is like the culture shock, right? Learning English at that young of an age. So I came towards the end of grade 4, and then they pushed me on to the 5th grade, and then pushed me on to the 6th grade. So learning English was definitely very tough, but also like just choosing a career path, um, when you have the grades that I had, um, you're like, I'm not smart enough. I'm not smart like the other kids. And I feel like those were the challenges, like me not knowing the amount of information that the next kid knows. Or like I look at my report card grade if I were to go back, and I look at the kid, a different kid. So I would get like 65 as my is that GPA or what do they call it now? Like your overall grade.
your average.
Yeah, average
Average.
basically. Yeah.
So like if let's say hypothetically, not hypothetically, it was true. I got 65 on everything combined, right? And the other kid, they have like 85s or 90s. Those are honor rolls, 90s, right? I'm like, damn, I wish, I could be like that kid. I go home, whatever I wish. It was not at the back of my head. No, it's just games and whatnot. It's not about education. However, I feel like one thing that has helped me was family, obviously, but also like the friends group I had. So we wouldn't do the things that you'll see today's kids they do. Uh, our main thing was just going to the park or learning something new or whatnot. Obviously, we messed around too, but to a certain extent, we weren't the kids on the street or whatnot. But we had our own challenges in a way or two.
What do you do other than your nursing thing? Besides nursing,
Yeah.
what are your hobbies? And
So, I like to hike. One funny thing about hiking is that I'm scared of heights. So,
you're doing all the stuff.
exactly, the things I'm scared of are like my insecurities. I'm like, all right, let me step out of my comfort zone. Obviously, looking back, I wasn't like that, before. But then I'm like, okay, I have to. So I go with my cousins, and if you were to ask them, right? So we would go like the caddish skills is where we went the last time I remember. So he would be in front, and he would have like a bag, right? I'll just hold on to his bag, and I'm just going like this because I'm scared of heights. Because I look down, and it's like
Oh,
one step messed up, and you're like going down.
No,
But
but hikes are fun though.
oh yeah, it's definitely fun. But some people are like, so how do you do it if you're scared of heights? Just do it. Take leap of faith. Another thing I feel like that has helped and changed my life was, learning about religion. You know, um, I'm not the most religious person, obviously, but at the same time, I tried to learn as much as possible. Praying the daily prayers, and when I was in school, I didn't have much contact with outside people like my friends or like family because you're literally taking a test almost every other week or so, and you can't fail. For us, exams and quizzes, you have to get a 78. Even if you get 77, they didn't curve at that time. You fail that class. Forget about the homeworks, right? So, what do you turn to, or what do you do on your free time? It's religion, sleep, eat. That, I kid you not, as bad as it might sound, that's a lot. That's the reality in a lot of field, whether it's healthcare, whether it's engineering or whatnot. So you have to have something that keeps you motivated, that keeps you going. But you get to a point where you have to build resilience. But yeah,
What do you mean by building resilience?
building resilience. So basically, if you see the same thing over and over again, right? How do you go about it? Like you mentioned earlier, what was the craziest thing? Do you see depth, right? How do you go about seeing depth and normalizing it, right? Or my definition, I might be wrong. My definition of resilience is getting used to it, being able to handle it. Obviously you're gonna have your emotions or whatnot because you're seeing people die, people having emergencies. But once you get out of work, take a deep breather, or during your break, if you get a break, take a deep breather, look back, reflect, you know, and it's easier said than done. For everyone, it's different. Um, I've seen coworkers cry. I've seen coworkers smile or whatnot after, whatever happens. But that's how they cope, you know. But yeah,
So like, how was like the high school life of yours?
high school life was not a great student for one. Um, let's see. Uh, High school life, it was all right, I'll say, right? It did teach me a lot, but then again, a lot of things you learn in high school, it doesn't teach you life lessons
What do
per
you
se.
mean by that?
Like, let's say, I spoke earlier about high schools should have like finance class because once
Yeah, I mean, we had the same conversation with a lot of people. So we had a podcast with Ahmed, right? So you know him. He's like a financial advisor. He works as a real estate agent. So he said that he pretty much touched upon that topic of like how this some schools should teach about finance,
yeah,
but then he had a reason to some why some schools don't have the reason behind it. And also we talked about this with Saad. Like a lot of the people we had, they kept on mentioning the one thing about the weaknesses of the Department of Education.
yeah,
And like when it comes to like it's called home economics is the teaching. So I had this conversation with my social studies teacher.
mhm,
She said that they used to in the 1990s, I believe, they used to have a home economic class. If you don't pass that class, you don't pass high school.
mm,
Basically,
Sure. Yeah.
they teach you, they teach you economics. They teach you basic skills like cooking and all that, all sewing, tailoring, and there was some more. I can't recall everything, but I don't know what happened. But they did get rid of that from the curriculum. I guess probably like because it was like just maybe it's not that important or something. But I think that they should bring that. And like going back to your point, they should like schools do not really teach you about taxes or anything like that. And then like once you actually get to that point where you're actually applying for FAFSA and everything, that's when the reality hits you about like taxes,
Yeah.
how much finance plays into role. Like that college process, I think like that's one thing
They
that
wait
hits
till the
a lot of
last
people.
minute.
No, not just wait till the last minute. It's just like it gives you a reality check about what to expect in life.
No, for sure, for sure. And I feel like, yeah, that's something we're lacking in the education system. You know, there are goods and then there are bads. If you were to look at the school district, right? School districts that has somebody that I just found out, well, heard today, and I know from before was that they were saying schools, let's say elementary school, might have a 5 out of 10 rating, right? But then you go to the school, you send your kids to school, and it's like the teachers are not coming. Why do they have low ratings? It's because of the community, it's because of the region, it's because of the funding. You know, rich neighborhoods like some parts of Long Island, they'll have a higher school ratings than some parts of Queens. It's because of the funding. Funding really plays a factor of like the location. Let's say Hollis, right? One of the school in Hollis has like a 5 rating. Why is it not higher? Right? How do we fix those school ratings? How do we get teachers to come in and teach these kids? Different, change of topic, obviously, from nursing, but I feel like teachers are underpaid.
Teachers are
Yeah.
definitely
That
underpaid.
can be my opinion. That can be, like,
I don't think it's not. It's just not your opinion. It's actually a fact that has been brought up to like a couple of governors, I believe, and also some mayors. The fact that the teachers are being underpaid,
Yeah.
and that they are revamping or like going through these processes to change the way that teachers can get tenure, not tenure but retirement.
Yeah.
So like teachers from, I believe I was talking to my teacher about this too, 2000 something to 2012 13ish, right? Around that time they had to get 65 years or 30 years of experience, and then they could retire with full pension. But if you do less than that or something happens, right,
You don't get the full.
you don't get the full pension. So they're kind of like, the teachers are kind of stuck in a place. They're like, oh, I have to do this to get this, you know. What are some advice, right, that you would give to yourself 3 years ago, or someone who's in your shoes and who's 3 years younger or younger than you?
Yeah. So, what I've learned based on past experiences is that don't let your failures define your future. And I might have plagiarized that, but again, it's fine. But that's a good quote, because just because you're failing, right? Think about me in high school. I was not the, brightest of minds. Think about me failing the entrance exam twice. People will be like, "Oh, you're stupid," or like, "You don't know what you're talking about." You know, who fails a nursing entrance exam, right? I did. Am I ashamed of that? No, because if I were to look back, I've learned from that, and I applied that to my current self. You know, don't just hold yourself off from the idea, oh, just because I got bad grades, I'm not smart enough. I can't be this or I can't be that.
Yeah, that's definitely true, because I think like school specifically, right? Like I keep mentioning this in like couple podcasts, but school specifically, they teach you that if you fail, your grades are done. So like, you know, you can't make it up. But in reality, like your failures define who you are. So basically, if you fail today, there's two types of people: either the person who actually learns from it, or the person he repeats it and then doesn't do nothing about it.
Exactly.
So there's this quote: a stupid is a person who repeats the same mistakes. A smart person is a person who learns from his mistakes, and a wise person is a person who learns from his mistakes and other people's mistakes.
And also, definitely be humble. Um, just because you have a degree doesn't mean nothing. You could be a pharmacist, you could be a doctor, you could be a nurse. Doesn't matter. Learn to respect those that have been there. Like, let's say my PCAs, right? Yeah, nurse, I have a higher degree than them. That doesn't mean I'm gonna treat them like crap or, oh, you're not a nurse. I'm not gonna take your opinion into account, you know? Oh, you're a nurse, but that person's a doctor. I'm gonna take their opinion. No, hear both of them out and go from there. And also, one thing to the youth, you spoke about advice is that ask somebody. Let's say you're interested in nursing. Like I know I keep going on and on about nursing, but ask a nurse. You go to the doctor's office. If you see a nurse, ask a nurse questions. Not all nurses, but some nurses. Like I'm happy to answer your question. You want to ask a doctor? You want to ask an engineer, pilot? If they have the time, they will answer you.
I think like, sorry to interrupt you, but I think like one thing I learned through my through going through aviation high school and like a couple of different career paths and everything, that there are people willing to answer anything or help you regardless of what happens. The only thing that you had to do is go up to them, ask them, or just show interest in it.
Exactly. If you don't ask, how are you gonna find out?
Exactly.
You all have your challenges in life, both at work and outside of work. You have to learn to leave that behind once you step into the, hospital. Let's say, for example, I could be having multiple things going on in my life. A person could be going through family deaths. They could be going through issues with their spouses or whatnot, right? You have to learn how to leave that behind. It's easier said than done. But because if you don't leave it, it's gonna affect your patient care. It's gonna affect your day. And for some, it does. For me, it has affected. You know, I'm not gonna go into it, but it has affected. And it's like, how do you separate it out? But you have your coworkers, you have your life. Everybody has their own thing going. A person could be smiling 1 second, but you don't know what's going on in the back of their head. You know, one person, I don't know how true it always is that one person said that always look after the person who's the happiest.
Because they're the most depressed people and
Exactly. Just because they show happiness outside doesn't mean their life is all, rainbows and sunshine. Again, just for some people, it might be. Speak with those people, speak with your family. If you want advice, ask those that are in those.
that's true.
If you don't ask, as you said, how are you going to learn? But I think that's enough.
I think like one of the
Yeah.
main points in our podcast is like a lot of people are scared to ask, or a lot of people don't have access to people ask people. So our main goal with these podcasts are basically get someone like nurse, financial analyst, whoever, get them on there, ask the questions from a perspective of a person who wants to know about it. So for example, like what are some struggles that you see in the nursing field? Like how much hard is it to get to that field? So like use that and give them the access to actually learn from it. And so they could, one, obviously we get all the the views, subscribes and everything, but the person who's watching it actually could leave with some information that, oh, now there's this career field that I can look into. Because I know for a fact with the 10, 11 podcast episodes that we did right now, I know that every single episode that there's something or some field that a person would learn from. An inspiration maybe. It could be anything, but there is at least that one gold nugget that they could take out of it.
No, and for sure, going back to that, I think a couple of the podcasts you did with Ahmed and the principal, actually, as well as other people you had on the podcast, even though I'm not in that field, those short clips did teach me one thing or another. There are a couple of points Ahmed brought up, and I really like the fact that he told the general public, because I don't think everybody knows about that. To be specific, he talked about the 2 types of interest.
Yeah.
And yeah, I had some clue, but I didn't know in depth of it. And I feel like this podcast really does. It goes into the life of the professional.
And that's like that's pretty much the thing.
Exactly. I mean, listen, this is just my point of view. It's not to generalize the entire field of nursing. However, if you have questions, you can always search, always ask, and learn from it, because if you don't ask, you're not gonna learn, and the worst somebody's gonna do when you ask them is say no. You know, but don't let that person's no stop you from asking the next person. You know, but again, this is whatever we spoke about today. This is just my point of view as a nurse. You know, I still have a lot to learn. Although it's a different field of nursing I'm doing right now, but it's always it's a learning lesson. It's a learning experience. Learning never stops.
That's true.
Thank
Very
you for
nice.
having me. I do appreciate it. I hope I helped some of you in the with the image of a nurse, basically.
Yeah.
What do we do?
I'm glad that you actually spent time coming on the podcast. It's like a professional like you actually giving your time to spread the knowledge and everything. I really appreciate it.
No, for sure.
Thank you.
Guys for having me. Take care.
There. Yeah. Thank you guys for watching the episode of Heart to Mic produced by Mars Studios.
Make sure to like, subscribe, and leave a comment, and share it with your friends.